Hey everyone, it's right at 3 o'clock. We'll go ahead and give everyone a couple more minutes to make sure they can hop on, and then we'll get started. Okay, hi everyone. My name is Brooke Satterfield, and I work in office of Mayor Andy Burke. And thank you all so much for being here and setting aside time for this webinar. We are really excited to hear from you and hear from our guest. But I'm going to turn it over to Jermaine Freeman. And he is going to facilitate this conversation. And yeah, we look forward to hearing from you guys. Jermaine?
Yeah, thank you, Brooke. Hello, everyone. Thank you for joining the City of Chattanooga for our webinar today. We know that there are some businesses that have been given permission from our local county government to reopen. And so we wanted to make sure that we provided some resources here, like today's webinar, to help business owners and managers safely and effectively reopen while helping us to continue to reduce the spread of COVID-19. So I'm Jermaine. I work here as Deputy Chief of Staff in the Office of Mayor Andy Burke with City Government. And I'm joined by my colleague, Brooke Satterfield, who also works here in the Office of Mayor Andy Burke. And we've got someone special who's going to be joining us today, Stacy Keating from CBL Properties. She is the Senior Director of Public Relations and Corporate Communication. And so we have asked her to come on to sort of share some industry insight in terms of how retail businesses could best operate safely and effectively to both be open, keeping in mind the recommendations and the guidelines that have come out from state government, but also to mitigate the spread of COVID-19. So with that, Stacy, you want to introduce yourself?
Yeah, absolutely. Thanks so much, Jermaine and Brooke. I'm really happy to be here with all of you today. Like Jermaine said, I work for CBL Properties. We are based here in Chattanooga and have been for over 40 years. We own Hamilton Place Mall and Northgate Mall locally, but we also have a portfolio of 61 other shopping malls in 26 states across the country. Starting in early March, the majority of those shopping malls closed due to COVID-19, and we ended up closing 60 of our 63 malls nationwide. As government orders have been lifted that have allowed retail businesses to reopen, we've started to slowly reopen our shopping malls in a number of states, including Tennessee. And at the end of the day today, we will have 22 malls that are open for the full retail experience, I will call it, and then 9 other malls that are open for curbside service only. Before we get into the presentation, I do have to give a little legal disclaimer as required by my legal department. The guidelines that I'm going to talk through today are not guidelines that were developed by CBL. They are guidelines that are informed by the Tennessee Pledge, the National Retail Federation, the International Council of Shopping Centers, the CDC, and other health organizations.
All right, perfect. Thank you so much, Stacy. We really appreciate you taking the time to join us today. Thank you for all that you're doing in the community, and thank you for being a part of this presentation. So with that, I want to make sure that we use our time most effectively. So I am going to sort of step back and let you kind of take it away from here and to kind of get into your slides. And then after Stacy sort of goes through her presentation and her deck, we'll open it up for some Q&A, and I'll have some follow-up questions, and we'll go from there. Stacy, does that seem cool to you?
Yeah, that sounds good.
All right, perfect. Brooke, if you would help Stacy take it away.
Yep, I will go ahead and share my screen. Okay, hopefully everybody can see my slides. First, I just want to talk through a little bit of CBL's reopening approach. So as I mentioned in my intro, we're slowly starting to reopen our properties based on government mandates being lifted that required us to close. So there's two things that we consider when we are going to reopen one of our malls. It's the effective date where we can actually reopen the mall based on what the government is telling us, and then also allowing ourselves and our retailers time to ramp up their operations. So we want to make sure that we have the proper PPE in place at our properties, that our management teams are well informed of the policies that we're going to put into place. But in addition to that, our retailers have their own approach. Some of them have chosen to reopen when we reopen the mall. Others have chosen to wait a couple of days to give themselves time to acquire the appropriate PPE, to make sure that their stores have been deep cleaned, to make sure that their staff is comfortable coming back to work, to address any inventory issues that they might have, to make sure that they have the correct merchandise in store, and to consider the layout of their store so that they can meet the guidelines that have been put into place by the Tennessee Pledge and other recommendations from other health organizations, and taking into consideration their ability to implement those measures. So my slides aren't moving, that's not good. There we go. Okay, so just a quick run through of what I'm going to go through today before we open it back up for questions. I'm going to talk through a couple of points of the Tennessee Pledge and how you can implement those guidelines within your individual stores, adjusting your operations to work within those guidelines, educating your employees, and then ultimately communicating everything that you're doing with your customers. So the Tennessee Pledge is broken down into 5 basic categories. I'm not going to go through all of these with you today. I think that the resources that Brooke and Jermaine are going to provide when the webinar is over is going to include a link to the full document of the Tennessee Pledge, so you can read through that at your convenience. But I want to touch on a couple of really important pieces. And the first one that we are doing and implementing at our properties, not only in Tennessee, but nationwide, are health screenings. So our management staff is going to be required to question our employees to determine whether or not they're experiencing any symptoms at the start of each shift. We were also fortunate enough to be able to procure enough no-touch thermometers so that our managers can take the temperature of their employees upon the start of each shift. But at a minimum, you should request that your employees take their own temperature prior to reporting to work. And then obviously, if any employee answers yes to one of the screening questions, is running a fever, or has any other symptoms, they should be asked to leave the premises and seek medical care. A couple of the other important pieces of the Tennessee Pledge are social distancing, which is something that we've talked a lot about and heard a lot about throughout this entire coronavirus crisis, and then also discouraging large gatherings. So we'll get into how you can set up your store to discourage gatherings and maintain social distancing protocol a little bit later in the presentation. The other thing that the Tennessee Pledge covers is the recommendation to wear personal protective equipment. The CDC recommends that employees should wear cloth face coverings or masks, and it's up to you to determine that policy for customers. The Tennessee Pledge does encourage customers to wear it, but I know I've been out in public and not a lot of people have adopted that policy. So it's up to you whether or not you want to enforce that policy within your store. Some of our retailers have opted to enforce that policy. We're enforcing it where it's required by us, but that's something that you want to consider as you're determining your reopening plans. The other thing the Tennessee Pledge covers is occupancy restrictions. For right now, they're limiting customers to 50% of your maximum store occupancy based on the building and fire code. So you need to determine how you're going to enforce that policy. Consider what your store traffic is going to be like when you first open, and determine whether or not you need to place a member of your staff at your front entrance to make sure that you're monitoring and being cognizant of that occupancy restriction. And then one of the most important things is cleaning and disinfecting procedures. You should always wear disposable gloves, clean with soap and water, and then use an EPA registered disinfectant. And I believe there are going to be resources that are available to you that list some of those when this is all over. And then you also want to establish a cleaning schedule. The CDC recommends a minimum of every 2 hours, focusing on high touch areas that I'll talk through a little bit later. And then also when things are visibly dirty within the store. So your store operations, there are a lot of things to take into consideration when you are preparing to reopen. And the first thing is, what hours do you want to operate? We made the decision when we reopened to adjust our operating hours and operate from 11 to 7 Monday through Saturday and noon to 6 on Sunday. This gives us more time to implement a more rigorous cleaning schedule, but it also helps you with your staffing to make sure that you're spreading staff out and you're limiting the interaction between customers and staff if you have extended hours. Another thing that we haven't personally done, but that many of our retailers have, is establish dedicated shopping hours for the elderly, vulnerable populations, or healthcare workers. You know your customer better than anybody. Determine whether or not something like that makes the most sense for your store. And then staffing. Stagger your shifts and breaks to maintain social distancing. Make sure that everybody that's working is not starting at the same time, that they're not taking breaks at the same time. And consider these questions from NRF when you are building your schedule. What are your expectations of crowds upon reopening? Are you adjusting your hours of operation? And what is the minimum number of staff necessary to operate and still provide a positive customer experience? And then probably the most important thing is cleaning and disinfecting procedures. So be sure to provide 60% alcohol-based hand sanitizer at your entrances or throughout the store. Establish that cleaning schedule and focus on high-touch areas throughout the store: tables, merchandise displays, doorknobs, light switches, countertops, your POS systems. Really walk through your store either physically before it opens or in your mind, and kind of consider all of those areas that people tend to touch and add those to your cleaning checklist. The other thing to consider is your store layout. A lot of our retailers have reconfigured their stores to determine a traffic flow. They've established one entrance or one exit to control their occupancy and make sure that they're able to monitor that. So that's something, if you have the ability to do, that you should consider doing as well. In addition to that, consider your store displays, including any soft seating areas or natural gathering places throughout the store, to discourage customers from gathering together in large groups, discourage them from interacting with the merchandise to the extent that you can, and then also eliminate product testers and in-store sampling. We found that most of our retailers have elected to close their fitting rooms for the time being. It just eliminates another high traffic area that you have to focus on cleaning between each use, and it helps to maintain social distance between your employees and your customers. However, if you're not comfortable closing your fitting rooms and you want to allow your customers flexibility to try on merchandise, the National Retail Federation recommends that you remove unpurchased merchandise from the sales floor and steam it and let it sit for a few days before bringing it back onto the floor. So if you are going to close your fitting rooms, the one thing you may want to consider is eliminating strict return policies or lengthening the return windows to give your customer the ultimate flexibility. If you're going to encourage them to take merchandise home to try on, give them the time they need to sit with it and determine whether or not they want to keep it, and then allow for the flexibility of them to return it. One of the areas of the store that is probably the hardest to eliminate the more close contact is your point of sale. So if you have multiple registers, it's recommended that you close every other line in order to maintain social distancing. Industry best practices and in the Tennessee Pledge guidelines, it recommends that you install plexiglass shields and then clean those shields every 2 hours or if they are visibly dirty. And to the extent that you're able to, consider implementing contactless payment methods like Apple Pay, self-checkout, or designate a location within your store that allows for customers to buy online and pick it up in store. And if possible, go paperless. This eliminates the use of pens, the transfer of a receipt back and forth from employee to customer, and ask customers if they can receive their receipt by email or text. Shipments, when you're receiving merchandise within the store, or if you have to ship something out to a customer, see if there's a way you can work with your service providers for contactless delivery, and be sure that after you receive any shipment or mail that you're washing your hands or you're using disposable gloves when you're handling this material. So the next thing you have to consider is, are your employees comfortable coming back to work? It's important to communicate with them clearly what your expectations are upon returning to work and determine whether or not they're comfortable coming back under those guidelines. If they are comfortable coming back and you've decided to reopen and what your reopen date is, it's recommended that you put together a welcome packet, kind of like a one resource guide for your employees that includes reminders about safety and wellness. So reminding them to stay home if they're sick, have a fever, or experiencing symptoms. Be sure to include a detailed opening checklist or cleaning checklist and things that will have to be accomplished every single day in order to maintain the guidelines within your store. Include CDC guidelines for the proper use of PPE if employees and customers are required to wear cloth masks within the store. And then also provide guidelines on basic hygiene practices to help limit the spread of COVID-19. I mentioned cleaning checklist, and then be sure to include your updated policies and procedures. And we've also created an FAQ document that can help you address employee questions, but also help your employees address questions they may receive from customers. And then in your back of house or your break rooms, post signage on various health policies, which are all available to be downloaded from the CDC's website, hand washing guidelines, guidance on COVID-19 symptoms. And then probably one of the most important things is to continue to educate yourself as these guidelines evolve, and then therefore educate your employees. Most of the markets that we work within have instituted a multi-phase reopening for retail. And so pay attention to what phase you're in, what the occupancy restrictions are during that phase, and when those guidelines are likely to change, and continue to educate your employees on those changes. And the last thing is communicating all of this with your customer. You know, we've heard a lot of feedback, and there's a lot of mixed reviews about whether or not people are comfortable coming back into these public spaces. So what we've done when we've reopened a property is we've established one source of truth. We've built a dedicated landing page on our websites that have a list of all of the precautionary measures that we're taking at each of our properties. And then all of our other messaging, social media, email, text program direct customers back to this website landing page. So whether you use a website or a pinned Facebook post, make sure that that information is readily available and accessible to your customers so that they can find it if they need it. If you have a voicemail system, be sure to update your voicemail with your new store hours, your opening date, and if there are any policies and the procedures you expect your customers to follow, like if you're going to require them to wear masks before they enter the store. And then in-store signage. Physically walk through your store prior to reopening and assess what your needs are. I've got a couple of examples of what we've done at our properties on the next slide, but consider things like signs on your merchandise displays that encourage customers to limit their interactions with merchandise, door clings that remind customers to be mindful of social distancing or occupancy restrictions. We've also done a stop and self-evaluate if you have symptoms, please don't enter the property. So it's a little bit of the honor system, and people have to take some personal responsibility there. But we do want people to be aware and cognizant when they're entering the property if they're having any symptoms. And then you can use floor decals to illustrate traffic flow and encourage social distancing in high traffic areas like checkout lines and around displays. And then if you have publicly accessible restrooms, be sure to post CDC hand washing guidelines in those places as well. And like I said, this is just a little example of some of the collateral materials that we have put together. We recognize that not everybody has the resources of an in-house creative department like we are fortunate enough to have at CBL. But there are a lot of resources available that are going to be shared with you after the call. There's a lot of resources that can be downloaded directly from the CDC's website. And then there's also resources available from the state of Tennessee through the Tennessee Pledge. Okay, I think that covers it for my slides.
All right, perfect. Great job, Stacy. Thank you so much. Lots of information there. I wanted to kind of follow up with some questions before we open it up for the Q&A with our viewers. Stacy, can you talk a little bit about best practices or recommendations for like deep cleaning retail stores? Like as I think about that, I'm thinking about like inventory. So like people walking in and wanting to touch sweaters or pants or blouses that are hanging on racks or situated on shelves. How would a retail store try to keep some of those items that are on display clean, knowing that those are going to be high touch items that people interact with frequently?
Sure. So one of the things that you can do is to adjust your operating hours, just give less opportunity for people to be in the store. So restrict those operating hours, post signage. You're going to have to try to see how it works for each of your individual needs and your store needs. But I've seen a lot of retailers have posted signs on their merchandise displays that encourages customers to limit their interactions. Like I said, closed fitting rooms, because that's one of the areas where people are going to be interacting heavily with merchandise. And so if you can restrict their access to fitting rooms, that's ideal. And then if they do end up purchasing something, extend those return policies so that they can bring them back down the road.
All right, perfect. That's super helpful. And then I think you touched on this during your presentation, but I just wanted to reiterate, are you all sort of advising your store operators to have dedicated shopping hours for some of our most vulnerable populations like senior citizens or people who have pre-existing medical conditions? Are you guys taking that into consideration too?
We're definitely taking that into consideration. We haven't implemented those hours at the mall level, but we would encourage any retailer that serves those types of communities to make those considerations for their own store.
Yeah, perfect. And then in terms of the steps or actions, in terms of like customer screening, are there any sort of additional best practices that stores should use in terms of how they communicate these expectations to guests and customers? Just because like this is a new world, right? And so, you know, customers are going to come into the mall and they're going to come into stores and they're going to be faced with like PPE and like wearing face masks and being temperature wanded perhaps. Do you guys have any best practices or tips on how a retailer could communicate that information beforehand?
Sure. So if a retailer decides to implement those types of protective measures at the entrances of their store, they can definitely communicate that through any website or social media that they may have to communicate their new policies to their customers, and also educating your employees on what your policies are and how to delicately address those if a customer becomes uncomfortable with the measures that you have put into place. We are not temperature screening customers as they enter our shopping malls unless it would be mandated by the government. So we would recommend that a retailer make the decision that makes the most sense for them in their store.
All right, very good. So this has been super helpful. And so at this point, I think we've got some questions. I've seen a few questions pop up in the chat. I've seen some hands raised. Brooke, do you want to start with maybe the questions in the chat?
Yeah, sure.
Calling on some people.
Yeah, so we've got a couple of questions from the chat. David Steele says, Stacy, can you comment on the concept of kid-proofing retail sites as well? Often store operators think of their typical customers as adults, but then they forget that kids who may accompany their parents to a retail outlet may have different sightlines and touch points and fewer inhibitions.
That's a really good question, and that's a great point to make. One of the things that we have done at our malls is to close all of our children's play areas and kiddie rides so that there are less touch points for not only adults but also for kids. But when you're walking through your store, try to take those things into consideration. Think about it from the perspective of a child as well, and see if there's merchandise that you can limit from remove from being closer to the floor, that's kind of at a height or sight line of a child, and just try to limit their interaction as best as possible. You can also communicate that with parents as they are coming into the store if they have a child with them, and just try to be as concise and clear as possible with customers on what your policies are.
Yeah, that's great. And then we've got another question from our friends at UTC. Laura Cagle says, and if you can answer this question, I'm going to be very, very thrilled to have an answer, but how long do you expect for some of these procedures to be in place? For instance, do you think managers will still be taking employee temperatures in August?
I don't know how to answer that, I'm sorry.
Jermaine, do you want to kind of touch on that?
Yeah, I'm happy to. I think that right now that's a big unknown. I think it was Laura that asked that question. And so right now, I think that's a big unknown. Obviously, I think that the state and local government wants to sort of see and monitor the situation to see, how our infections go over the course of the next several weeks as we sort of decide whether or not to move from a phase 1 to whatever the next phase is. So I think that's the big unknown right now, which is why, I think we are hoping that as stores and as businesses start to reopen, we can continue to do everything we can to stop and slow the spread of COVID-19 so that there's not the need to close down businesses all over again because there's a new outbreak or a new surge. So I think, Laura, unfortunately, my answer is probably unsatisfactory, but I think that's the big unknown and the big question mark right now.
So if any of you, a couple more participants have put questions in the chat, but if you also, if you want to do the raise hand feature, we're happy to let you to ask out loud as well. We have a couple more in the chat, sort of just about where can people go to order masks, hand sanitizer, gloves, and with price obviously in consideration, and then and delivery. Stacy or Jermaine, if either of you want to talk about that.
Yeah, Jermaine, do you want to tackle that one?
Yeah, so I think what we can probably do is just put together a list of resources. I know there are a number of some local manufacturers that have sort of moved into the PPE scene. And so I think after this call, it would probably be best for us to send out that information, especially on the hand sanitizer side, as well as possibly the mask side. Obviously, of course, I think a lot of the recommendations right now are to not wear the N95 mask because those are being reserved for healthcare workers, but to wear other types of masks. But I think we can make that information available after the webinar.
Speaking of masks, if there are businesses that require masks for customers, is there a sample script or something to potentially address customers that are refusing to comply?
Yeah, that's actually included in the FAQ document that's going to be shared with everybody after the webinar. And if anybody has any additional questions or wants some additional information, you can reach out to Brooke and Jermaine and they can connect us.
Great. let's see. It is my understanding that we are limited to no more than 10 customers at a time. Does that 10 people limit, does that include employees as well as customers?
I believe the Tennessee Pledge guidelines, it's only customers. It does not factor your employees into that number.
What if our employees do not feel safe due to compromised immune systems? That leaves us short-staffed. This may be a legal question, but any insight on what to do with that?
Yeah, that's definitely more of a legal question and something you would have to work out with your individual employee.
If we offer to provide disposable masks to customers, can we ask for contributions to offset the cost? That may also be illegal, Jermaine.
Yeah, Jermaine.
That is a good question. I don't know the answer to that one, so let's bookmark that one for follow-up after this webinar.
Yeah, and just so that everyone knows, we will obviously have these questions, so we'll make sure that we do our best to get all of them answered, and then back to you guys. What special steps should be taken in regard to public restrooms?
So I can tell you what we're doing at our properties. We are blocking off every other sink in our public restrooms. We are closing every other restroom stall, and then we are implementing the rigorous cleaning guidelines that have been set forth by the CDC.
Great. Let's see. Do you think the customer requirement to be clean will fade as the crisis fades, or do you think that this newly enhanced effort to be clean is a new normal? End of question, sorry.
Jermaine, I don't know if you want to tackle that one too.
Yeah, sure. I think that, you know, I think that it depends, you know, a little bit on who you are and where your geography is. I think that if you're in places that have that probably have denser populations, like this is probably going to be kind of our new normal for a while. I think, you know, just in looking at the places across the country that have higher numbers of cases, you know, it's gonna be a while before things just go back to the way they used to be pre-COVID-19. And so I think it's probably in all of our best interest to just sort of make peace with the new normal and to kind of get used to it. Because again, the name of the game here is to prevent a second surge or second outbreak. We don't want to see that under any circumstances. We don't want our hospitals to be overwhelmed. And so anything that we can do to prevent that going forward is valuable, and it saves lives.
Another question that we got, are there certain kinds of merchandise that are especially prone to contamination and spread, whether it be because they trap more bacteria or because they're harder to clean? Anything that either of you know of that are key things that people should watch out for, like hard goods versus clothing versus food, beverage? Either of you know anything about that?
The CDC actually offers guidelines on their website for the cleaning of different surfaces, including porous surfaces and non-porous surfaces. And there's a link to that at the end of my presentation. So if you're going to share the presentation, that's in there. But it includes guidance for like soft seating or clothing and things like that.
Great. And then another question. Is it 10 customers max, or is it 50% occupancy max? And I actually just looked that up on the Tennessee Pledge, and I believe it is 50% or less of the store occupancy. Okay, a couple more questions. Tasting opportunities have been a key part of our sales process. Is product tasting specifically prohibited or strongly not recommended?
It is strongly not recommended, not only by the Tennessee Pledge, but also by the National Retail Federation and the International Council of Shopping Centers.
This is a really good question. As businesses are reopening, what is the best local source for daily monitoring of Hamilton County infection and hospitalization rates? If they go up, we may want to be more conservative and close again to protect at-risk employees.
Yeah, so the best source of information for that is going to be the Hamilton County Department of Health's website, which we will make sure to post after at the end of this webinar. There's also a COVID-19 hotline that the Hamilton County Department of Health has. So if you have any questions, you can always call the hotline for some additional information. But I believe it's at 3 p.m. each day, the Hamilton County Department of Health updates their complete list of people who have tested positive, or the number of cases of a positive test for COVID-19, as well as a number of negative tests for COVID-19 throughout the county. And so they post that information on their website. So the best place to check on that is the website for the Hamilton County Department of Health.
So before we close, I just want to quickly run through some of the resources that we will send you guys, or you guys will have access to after we finish this webinar. And so the first website is just cha.city/COVID reopen, and that's going to be where you can find a lot of the reopening safety guidelines. So we've got, let me just share my screen. So we've got all of the reopening safety guidelines here with Hamilton County reopening information, the Tennessee Pledge, CDC, OSHA, the list of disinfectants, and then the Hamilton County website. We've also got a couple of resources here that they are just, they're signs, mask and wash your hands signage that were created by someone in our office that you guys can use as you see fit. And then we also have a list of, just a list of links that people can, okay, it's taking forever. It's just a list of links that, you know, resources where businesses have, there we go. So different print resources. So CDC has several different print resources, as Stacy talked about, the Tennessee Pledge Toolkit, and then there's several different, if you're not a graphic designer and you don't have a graphic designer, a lot of these websites have free downloadable signs for wearing masks, encouraging social distancing, hand washing, there's all different types. And then some of these resources also have different supplies that you can order as well that will be helpful during this process. So after the webinar, you guys will get all of this, including a couple of other documents that just sort of consolidate the guidelines that we've discussed today. And then this webinar will, we recorded this, so you'll all have access to this. And then the frequently asked questions document that Stacy made, all of this will be available to you guys after this is over. And then if Stacy, do you want to put up that last graphic or that last slide? So there's the link that we talked about earlier, cha.city/COVID reopen. And then I will give it to Stacy and Jermaine to close us out.
All right, thank you, Brooke. Stacy, big thank you again for all the work that you did to put together the presentation with us and to share all of this information to retailers. Anything you want to say before we go?
No, just thank you so much for organizing all of this and for being a resource.
Yeah, absolutely. Thank you for your industry expertise. Brooke, great job as everything, doing all the things that you do. And for those of you who are out there, we really just want to sort of reiterate this. Even though a number of small businesses and a number of businesses in our community have been given the permission to reopen and the authority to reopen, if you don't feel like you can reopen safely and you feel like you should remain closed for a while longer, you're not obligated to reopen. And so I just wanted to share that with you, just from my side as a public servant. If you feel like you can't safely reopen and you can't implement the guidelines that our county and state government are recommending, and you think it would be better for you to remain closed for a while, you have that option. And so we just want to make sure that you're aware of that. But if you have any questions, please feel free. You can always contact me and Brooke here in Mayor Burke's office. If you have any health-related or COVID-19 questions, the best contact is going to be the Hamilton County Health Department at 423-209-8383. For those of you who are on the webinar today who are business owners and managers, if you have specific questions about best practices for keeping your storefronts and your stores and your shops clean and infection-free, please reach out to our colleague Bonnie Deacons, who is the Director of Environmental Health for the Hamilton County Health Department. She can answer a lot of those questions. And then we've got the link up there for the Tennessee Pledge Guidelines from Governor Bill Lee, which is really what is sort of informing our retail sector here in our local community in terms of how you should go about reopening. And then for those of you who are interested, obviously tomorrow it'll be a little bit of a different crowd, but we're going to do another webinar for salons and barbers because obviously they have been given the green light to open this week as well. So we want to make sure that we talk about that. So that webinar is going to be tomorrow at 12 noon. And again, if you have any questions, feel free to follow up with Brooke or myself. Brooke is going to send out, I see your question, Keely. Brooke's going to send out some information about how you can sign up for the future webinars. We are also planning to do a webinar. We haven't scheduled it yet, but we're also planning to do a webinar for gyms and fitness facilities or exercise facilities, and then a webinar for child care centers as well. So as soon as we have those dates confirmed, we will make sure that we share all that information with you. Stacy, thank you again. You've been great. I really appreciate all your help. And Brooke, fantastic job as always. All right.
Thank you.
All right. Y'all take care.